I'm Dr Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on orbital decompression, medial or lateral wall. Well, I get asked all the time by patients, I've been recommended to have a lateral wall decompression, not to have a medial wall decompression, because they can remove more bone. What is the difference? Why lateral wall? Why medial? Why not all? When do we do what? I want to go through some key things that it's important for patients to understand because it is confusing. And you'll hear different people say different things. Firstly, what is an orbit? An orbit is an eye socket. When people get punched in the eye socket, have a fractured eye socket, that is the orbit. And I'm going to show you here, this is a human skull. Yes, a real human skull. This is an eye socket here. This is the piriform fossa of the nose. This is the other eye socket. When you look in the eye socket, there are bones, and we're talking about the inner wall here and the outer wall here. This is your cheekbone. So when you get punched in the cheek, you smash this, you smash the bottom of the eye socket. So that's what we mean by the orbit, and that's what we mean by the bones. However, how does that translate to orbital decompression surgery? Let's have a look. When you look at a scan, here is a scan, and you'll see here the orbit bones, and this is the sections for the orbit. This person did have a broken socket bone. The image on the left shows it to be deeper. But you'll see a bony view showing you the bones of the orbit. So the outer part is the lateral and the inner part is the medial wall. Let's have a look at what a lateral decompression is. So with the lateral wall decompression, you go through the outer part onto the bone, and you can see the bone is in white. So patients say, oh, there's more bone in the outer part, therefore the lateral decompression is better. But don't think of it in terms of how much bone there is. You can see there's a thick bone and the inner part is quite thin. What I've outlined in yellow there is the lateral wall that we decompress. It's probably only going to give you about 2 millimeters of space. Don't think about it in terms of bone, think about it in terms of space. To compare and understand, let's look at the medial wall. Here's the medial wall. So the bone is actually thinner, and we can remove it. But it's not the removal of bone that is allowing you to decompress and push the eye back. Yes, removal of bone is a decompression, but it's the space that pushes the eye back. And what's next to the medial wall? All this space. We know them as sinuses. The yellow ring there outlines the ethmoid sinus and the maxillary sinus. And we literally push the whole eye socket back into that space. We enlarge it by that amount of space. We've got heaps of space in there. So you can end up pushing an eye back 8 millimeters just going through the medial wall. That is a medial wall decompression. Why do we do it? It's through the nose, doesn't cause bruising or swelling, it's all hidden, and we get so much more space. And that is why it is my preferred approach, and I'll always do a medial wall and a medial floor before I even think about the lateral side. Here is a lady who's had a lateral wall decompression. I've done it. You can see when the ring there's some stitches there. You get bruising, you get swelling, the eye looks a bit red. It doesn't make a huge difference. I did it as a top-up. She's already had a medial wall decompression. So that's what I use it for, as a top-up decompression. Here is a lady who's come to me with acute blindness in the right eye. That's on the left side of your screen. And she suddenly lost vision, and I have to push the eye back. And I want you to see what it looks like after a medial wall decompression. Bingo, that's what it looks like. No bruising, no swelling, but notice that the lower eyelid has gone up because I pushed the eye back. Now it's a 2D photo, so you don't get the dramatic effect visible in a 2D photo. She notices it, but there is a way I can demonstrate this to you. Let's have a look. When you look at it from below, just look how far back the eye's gone in. I've drawn a yellow line there, although you don't really need it. And this lady is just 1 week out of surgery. And it's a medial wall decompression. She's got no bruising or scarring, and the eye's gone back in a long way. So that's what it is all about, medial wall versus lateral wall. And I hope that helps you make a decision. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastics in Sydney, and thanks for watching.